So good morning. My name is Chris Merkel. I am the health officer of the Monmouth County Health Department. I'd like to thank everybody for coming to this hoarding workshop. We think it's going to be very informational. We have great speakers. We're going to have a great panel. We're going to have a Q&A discussion. So I'm going to be serving as your moderator for today's event. Our theme, Connecting Disciplines, Building Solutions, reflects what today is really all about: coming together across agencies, departments, and disciplines to understand hoarding in a deeper way and to strengthen our shared response. We know that hoarding disorder is a multifaceted issue. It affects individuals, families, neighborhoods, and entire systems, from mental health and public safety to housing, legal, and social services. What makes it especially challenging is that no single agency can address it alone. But when we work together, we create the possibility for meaningful, lasting solutions. Today, we'll hear from experts in clinical mental health, legal services, public health, housing, and enforcement, each offering a unique lens into both the causes and consequences of hoarding, as well as how we can intervene ethically, effectively, and with empathy. Throughout the day, we encourage open dialogue and cross-sector learning. Whether you're here as a public health official, legal advocate, code enforcement officer, clinician, or housing provider, your perspective is essential and your participation matters. Before we dive into our first session, just a quick reminder to increase awareness of hoarding disorder and its impacts, to share practical strategies that agencies are using in the field, and to promote collaboration that leads to better outcomes for individuals and communities alike. So with that, I'd like to introduce our commissioner, Commissioner Sue Kiley. It's my pleasure to introduce someone who has been a steadfast advocate for public health and human services in Monmouth County. Commissioner Sue Kiley serves as the Monmouth County Commissioner Liaison for the Department of Health and Human Services, where she leads efforts to support some of our most vulnerable populations. Her leadership has been instrumental in fostering cross-agency collaboration, particularly around mental health, housing, and community well-being. With that, Commissioner Kiley.
Thank you. Hi, everyone. Welcome. I am very, very anxious to hear about this topic because there's very little I know about it. My background is in nursing and then in healthcare sales. So I was always in the healthcare market. But I worked in an emergency room, so there were not times where anyone with a hoarding problem would show up in the emergency room. So it was something I never really thought about. The first time I thought about it was several years ago. I was teaching a children's choir. And, you know, all these kids from 5 years old up to about 12. And they'd come up and they'd sing their hearts out, you know, but that was all I really knew about them. And one of them lost her mother. Her mother passed away. And she was so heartbroken. I'll never forget it. I just felt so bad. And I, again, realized how little I knew about these kids. So I got a phone number. I called the house and I said, and I asked about her father. And they told me, oh, you know, he's got some issues. Okay, that was all I knew. So I called her and I said, listen, I want to come and see you. I want to make sure you're okay. And she said, oh, you don't have, thank you, but you don't have to do that. I said, I really want to do that. So I went over, knocked on the door, and I could hear that there was somebody in the house. And she finally came to the door and opened it. And as she was opening it, she was like kind of pushing something out of the way that was by the door. That was my first experience with hoarding. I mean, you literally could not get into the living room because it was packed almost to the ceiling, as was the rest of the house. And I was so taken back by it that I didn't even know what to say. But I looked at her face and she was humiliated. She was upset. She was embarrassed. And I thought, this isn't the person that has the issue, but this is a person that's living through all the side effects of that issue. And it stuck with me. It stuck with me for a long time. But I never realized it was a big enough problem for us to do something about it. So this is great. I'm going to learn a lot more than I knew before. And the other thing I wanted to say is that Monmouth Acts couldn't be a better platform for this kind of a problem. Because in Monmouth Acts, the thing we learned to do so effectively was share information with our other partners. So if I couldn't help you, I could send you here, or I could send you here. I can't imagine how helpful that's going to be, because there are so many aspects of your life that are touched if you either are a hoarder or if you're someone that lives with one. So I hope you learn a lot. I hope you have a good time. And thank you for having me.